Okay, so we're going to be talking about, or just briefly going over, the Unit 3 exam. So this is kind of a review for that. So if you use this, I think you'll do very well on your Unit 3 exam. So, I've made a list here. What I would recommend doing is to just go through and, make a copy of this and then go ahead and put your answers down. Kind of do some researching through your lessons, write your answers down, and use that as a study guide for taking the exam. So, they ask, like, what is a patient bill of rights? It is a multiple choice exam, and they'll ask things like, is that patient bill of rights, is it just for healthcare workers? Is it maybe some laws that patients must follow? So they'll kind of want you to key in on exactly who the Bill of Rights is for, and in what regard it's for them. Like, is it something that they need to do, or is it something that we do for them, or some rights that they actually have as patients? Informed consent, very, very important thing. It's different than just consent for a procedure. All surgeons, anybody that does any procedure on a patient has to actually obtain informed consent before doing the procedure. So you'll definitely want to know the difference between just a consent and what is informed consent. Let's see, what does the patient bill of rights say regarding errors? What if there's an error in your record, and you find that out? Do you have is there any avenue that you can follow through to have that error taken out, or does it have to stay there? Or what does a patient bill of rights, which would including you, if you were a patient, say about things like that? What is a patient's rights in an emergency situation? If they go and have no money, can they go to an ER? Can the ER say, nope, you don't have any money, it's an emergency situation, but I'm sorry, you have no money, we can't take you. So I want you to know whether, what a patient's bill of rights in an emergency situation is, even regarding 911 calls. If someone's over 25 and needs insurance, can they be on their parent's plan? What is the age as far as a student or a young person being on a parent's plan? First patient bill of rights was first written up by whom or what? It's really not that old, really. But they kind of give you a familiarity with how long has this been going on, where we actually do have a patient bill of rights. Now, what if there's a violation of the patient bill of rights? And let's say that a medical facility or some medical staff, but it's a non-willful violation. They didn't know, they should know. You're really responsible to know. But what if somebody didn't know? And they did something against a patient that they shouldn't have done? Is there a fine for a non-willful violation of that patient bill of rights? And if there is, what is it? Now, know about obtaining a new insurance plan, like, for example, say, maybe somebody moved from California to Idaho, and they were covered, under their employer's plan in California. And then immediately upon transferring over here, they now, have their insurance carrier is now through the employer here in Idaho. Does it cover pre-existing conditions? What if they had let their insurance lapse in California before they come here? Would the new company would they have to cover, a pre-existing condition? So kind of check your lesson and learn about that. Can law enforcement, which would be the police department, can they access a patient medical record if they suspect that a patient that comes maybe into the ER has been abused? Because not a lot of people can access a patient record. And I don't know if you've ever heard of HIPAA, but that HIPAA will also have some questions on your test. In fact, I think there's about 5 of them. But can law enforcement, access a record if they suspect a patient's been abused? Does HIPAA, that's how you pronounce it, HIPAA, does it provide protection for the security of medical records? What if you have HIV? Are they protected where no one can look at their records? So I want you to look into that. What about the security of health records in a medical institution like St. Luke's or St. Al's or wherever? Do they have any security in effect that protects your rights? And I can tell you definitely that is a true thing. In fact, there's quite a serious fine You could even lose your job, and probably would, if you access records that you're not supposed to be in. You can't even access your own records without having some type of security clearance. So it sounds kind of harsh, but you don't want, what if your neighbor was a nurse and you came into the ER and maybe you had some things that were going on in your medical history that you didn't want anybody to know, and maybe the nurse might think, oh boy, I know this neighbor here, I'm just going to look up and kind of see what's going on. Nobody would want that, and so HIPAA is very, very emphatic about the security of health records in any medical institution. What information is covered by HIPAA? You want to know, how about HIPAA and organ transplants? Like, who can know what? Like, what if somebody wants to donate an organ and the person that's going to be getting the organ says, well, does that patient have HIV? Are medical personnel allowed to look into the donor's record to see if there's anything that could be transferred or not? Or are they protected from that too in regard to organ transplants? Know the difference between ethics and morals, and there is a difference. Ethics, I don't want you to read it in your lesson, but ethics are more of guidelines for a group of people, whereas morals are more the beliefs of an individual. Okay, so kind of be able to tell the difference, Sarah. Must medical personnel adhere to a code of ethics? Right off the bat, without even knowing anything, if I didn't know anything about it, I certainly think my guess would be, oh, definitely, and that is true. So certainly there's a code of ethics that need to be followed by any medical staffing. The AMA Code of Ethics does not deal with which of the following. I put all of the multiple choice answers there, and I want you to find out which one it doesn't deal with. Let's see if I can bring this down here a bit so you can see the rest here. In which situation would a special respirator be appropriate? Let's see if I want to give any information on that. I guess what they're kind of talking about would somebody that comes into a medical, maybe the hospital, or maybe there's some staff that are working with patients that are in the hospital. What if the patients had the flu? Or what if they just had a high fever and a rash? Or what if they had a cough and a history of TB? Which one of those, or other scenarios too, would maybe staffing that was working with a patient, when would they want to wear an appropriate respirator so that they didn't get what the patient has? I want you to know what hazardous waste is in a healthcare institution. When is reverse isolation used for a patient? Oftentimes we put a patient in isolation, oftentimes to protect the staffing. They're in isolation. But what is reverse isolation? There's going to be some questions on restraints, whether they be limb restraints, around the wrist, or sometimes they could be 4-point restraints with, not very often, with the ankles and the wrists. They can have a vest that they put on. So know what type of restraints there are and know when and how they can be used, because there are some pretty strict regulations. You can't just say, oh, this patient's bothersome and we're going to put them in restraints. So you've got to, there are some, like I said, some strict regulations on when and how they can be used. There's that OSHA again. I want you to be familiar, and there's about 5 questions. Like, what are they involved in? Are they involved in safety issues for patients? Are they involved in safety issues for staff? Are they in charge of, I just want you to know what they're in charge of and what they're not in charge of, what they don't have anything to do with. And then they're going to give you some medical signs, that you might put up on a door, or you may see in a wall if you're going into a room, or doesn't mean a patient room necessarily. They could be used anywhere in the hospital. You need to know what they mean. And what's an MSDS? It's used to inform employees of what? And usually every department will have one. It's pretty important that it is available readily for any employee that's working in each department. So I want you to know what it is and what it informs employees of. So if you go through all this, I think you'll do just fine on that Unit 3 exam. And if you have any questions after you've worked through this, feel free to give me a call before you take the test, and we can talk about it. So remember to, when you fill it out, after you've done it, go ahead and give me a call and let me know that you filled it out. You can let me know at that time if you have any questions or not. And then I can give you points for watching this video. And then you can also use the information for your Unit 3 exam. So thanks for calling, and we'll talk to you soon. Bye-bye.